Hello and welcome to the Good Samaritan Regional Medical Center Joint Orientation class. My name is Trisha and I'm one of the nurses on the orthopedic floor. Ideally, this class would be taught in person so we could all meet, but because of COVID, we were asked to record these presentations for your viewing at home. I hope you find the material informative and that it gives you a good outline and understanding of the surgical experience. During this presentation, we will be giving you a walkthrough of your surgical experience. This will include everything from prepping for surgery, what to expect after surgery, and then preparing for discharge. Step 1 is preparing for surgery, and the next several slides will tell you everything you need to do to prepare for your surgical procedure. When you're preparing for surgery, make sure to go to and complete all the appointments that are made by your healthcare providers and your surgeons. One of the things they may ask you to do prior to surgery is to get your labs drawn or some type of swab, just to make sure we know what kind of health you're in prior to surgery. Depending on your provider, if they're Corvallis Clinic or if they're a Good Samaritan provider, you might have to get your labs drawn at different places. Some of these places might include the Corvallis Clinic, your actual doctor's office, or the Neville building, which is across from the hospital. During your preoperative doctor's appointment, they'll give you one of these guides to your joint replacement. This is a kind of an overview of what's to come as far as the surgery is concerned, appointments, follow-up appointments, things to expect. They might also discuss getting a MRSA or COVID swab. Now is the time of COVID, so we like to test preoperatively to make sure that you're okay before you come in. This will also include instruction guides for a CHG bath, which we'll touch on later in the presentation. When visiting with your doctor or your surgeon, please provide an updated list of your medications with the dosages and the frequency that you take them. So this would include all medications, vitamins, supplements, over-the-counter things, as well as prescription medications. We encourage you to bring this list with you to the hospital the day of surgery as well, and request that you leave your personal medications at home. We will be providing you with all the medications you need here. The day of surgery, their doctor may ask you to hold some medications, so it's really important for us to know what you're currently taking so you don't take something before surgery that you shouldn't. Our infection prevention processes have changed because of COVID. So in addition to the COVID swab, we will ask you to quarantine between the swab date and your surgery. We are also asking you not to shave anything except for your face 3 days prior to surgery, and to use a disinfectant soap that should be provided by your surgeon at one of your visits. This information is also provided in your joint replacement guide that you get at your doctor's office. Ultimately, what you want to do is wet your skin, you turn off the water, you put on the soap all over your body, and you let it sit for 2 minutes before rinsing. You don't need to get it anywhere near your eyes, ears, nose, face for the most part, and then you don't want to get it in your private areas that are normally covered by a swimsuit. After you're all clean from your shower, everything that touches your body also needs to be clean. Fresh towels, fresh pajamas, fresh laundered sheets. If your pets normally sleep in the bed with you, we ask that they do not during this time frame. We just want to keep you as clean as possible prior to your surgery. This also includes not using any powders, deodorants, perfumes, or lotions. The morning of surgery, we're going to have you shower again with that same soap in the same manner as before. But we do recommend wearing loose, flowy clothing that's easier to get on and off after surgery, and it's more comfortable for you in the long run with limited mobility and movement. We also recommend leaving jewelry and valuables at home. Anything that you're afraid of losing while you're here, no need to bring it. We understand that there are some personal belongings that you'll want to bring with you, and we just recommend that you have them labeled. Things like this would include your cell phone, your charger, glasses, CPAP, anything that you would need for everyday use. We want to encourage you to have them, but we don't want you to lose them. So labeling is very important. Again, that comfortable, loose clothing for after surgery is something that's going to be super helpful, and it's going to be significantly more comfortable for you to not only put on, but to wear. We also recommend non-skid slip-on shoes, so that way you have some traction while you're walking around. The hospital does provide some items, and this includes toiletries. So things like mouthwash, toothbrushes, toothpaste, Kleenexes. We even provide socks and combs. So these are items that if you did not want to bring them in the hospital for fear of losing them, we have them available for you. But if there's something specific you want to bring from home, again, we just recommend labeling it. Now that we've gone over what you need to do to prep to come to the hospital, we're going to discuss what actually happens once you get here. Please make sure you arrive on time for your appointment. You can check in at the admitting department, which is on the main floor near the main entrance. So if you have a very early surgery, you'll most likely check in through the emergency department, but all other surgeries will go through the main entrance. Once you've been admitted, you'll be taken down to our short stay department. There you'll receive a gown and an IV site. Unfortunately, at this time, because of COVID, we are not allowing families to accompany patients down to short stay. Before you're sent to the operating room, your paperwork will be reviewed. A nurse and an anesthesiologist will meet with you, perform a brief exam, and answer any remaining questions that you have about your procedure or the anesthesia. At this time, they may ask you to sign a consent form if that hasn't already been obtained. You'll be sent straight to the operating room from a short stay, and following your surgery, you'll go to recovery. Recovery is just an area where you can wake up a little bit from the anesthesia. So you may not remember a lot of things in this area, but they'll be doing vitals frequently. They might be offering you ice chips. They're just kind of getting you to wake up a little bit before you come to the floor. The third floor of the hospital is the orthopedic unit, and as soon as you arrive to the floor, a nurse or a CNA will come in and help take your vital signs. They'll do a complete assessment of you and your surgical site and then help you get acclimated to your room. At this time, they may also call your family to let them know that you have come out of recovery and into a room. This is an example of one of the beds in the orthopedic unit. Some of the rooms are private, some of the rooms are shared. They all have this style of bed. You'll have your own tray table, television. We'll acclimate you to how to adjust the bed, your call light system, and other functions of the room. So this is one of those topics that's going to be stressed repeatedly by me, by Alan, by Matt. Pretty much every presentation is going to contain this information, but what we want you to do is if you need assistance with anything, to please use your call light and ask us for help. Your safety is super important to us, and you've just come out of surgery. You're going to have lines and medications and things that you aren't used to, so please utilize us as a resource. We are here to help you and to keep you safe. There's a good chance that when you come to the floor, you're either going to be hungry or thirsty, so we start advancing your diet slowly. The anesthesia can make you nauseous, can cause upset stomach, so that's why we move more cautiously than we would normally. We'd start by giving you ice chips or water, moving up to jello or pudding, and then eventually full-fledged meals if you're able to tolerate all of those things. If you do continue to have nausea, we have medications that we can give to you if your doctor has ordered them, and if not, we can try and get those for you. The kitchen is open from 7 a.m. to 7 p.m. They're full menu orders, so you can order breakfast when you get out of surgery at 4 o'clock if that's something you would like. And the easiest way to remember how to get a hold of them is to dial food, which is 3663. We'll reiterate this when you come to the floor as well. This is just a little example of one of the menus you'll see. If you have a special dietary restriction, we have other menus that we can obtain. Just let us know. We're happy to grab them for you. While you're here at the hospital, we're going to emphasize movement. Not too much. We want to find that balance of keeping you safe, keeping your energy and your stamina level up, but we do want you to move because that does help you heal. So while you're here, we're going to encourage you to have your meals either up in the chair or at the edge of the bed. As soon as you order, you're welcome to call us with your call light. Let us know and we'll help you arrange everything. And if you need a blood sugar, we will check it at that time as well. Depending on your pain, mobility, and stamina, plus the feeling, whether or not that site is numb. We might not be able to get you walking and up to the bathroom right away. We do have bedside commodes as an option, but we are able to help you get to. I know it's not an ideal situation for most people, but when you gotta go, and these do the trick. A lot of our surgeons don't recommend showering until a couple of days post-op, but we do have these bath wipes that we can provide for you and help wash you with. If that's something that you're interested in while you're here, our CNAs should be offering you a bath at least once a day. Once you come to the floor, there's a good chance you're still not entirely awake yet, so we hook you up to fluids to keep you hydrated. Along with these fluids, we usually run a couple doses of antibiotics just because we performed a surgical procedure. We want to make sure things don't get infected. Odds are you'll have these running until the next morning, but if your fluid intake, if you're drinking a lot of things, if that improves over time, we can probably saline lock you so you have one less tube to worry about. Anesthesia can be a little bit harder on others when they're waking up. Some patients might require oxygen and they'll come up on tanks. But as you wake up, the goal is to get you off of that oxygen if it's not something that you need at home or use regularly. Another device that you'll see is called an incentive spirometer. And what this does, because you're not moving around as much as you normally would, this allows you to kind of exercise those lungs, get them nice and open, so that way we can prevent things like pneumonia from things settling in the bottom. While you're here in the hospital, we're going to be asking you about your pain a lot, and most likely we'll be asking you to rate it on a scale of 0 to 10, 0 being no pain at all and 10 being terrible, worst pain you've ever experienced. So the reason that we do this is we want to make sure that the pain medicine that we're giving you is appropriate for your level of pain, and we do it frequently because we want to make sure that the pain medicines that we're giving you are actually working. If it might be possible you need more, might be possible you need less, and we like to gauge that based on this scale. Your doctors are going to be the ones issuing your pain medication orders. So a lot of times we'll see things like Tylenol, ibuprofen, narcotics, and then muscle relaxers to help with those spasms after surgery. We try not to use IV pain meds for joint replacements. It's not something that you would be going home with. So again, we want to make sure that the oral medications we're giving you are working. Along with that, you'll come up with either a Polar Care or some ice. We have those things available. We can refill them as needed. That just kind of helps with inflammation, which can help with the pain. Some people will get regional anesthesia with a block a nerve in the leg or towards the knee. It's something like when you get your tooth worked on and they numb a side, and it dissipates with time. And then if the position that you're in isn't comfortable, that's something we can change as well. We can add more pillows, we can take pillows away, we can adjust your hips to make you more comfortable. So this is an example of a continuous nerve block. It basically keeps a low level of medication kind of numbing an area, so to speak. This is common with some knees, if depending on your provider. It's something that's adjustable, and it's something, depending on how long you're here, might be sent home with you. But there's instructions on how to use it, how to adjust the medication, and we provide you with numbers on discharge if you have any questions related to it. This is a Polar Care machine. It circulates cold water to an area. In this case, it comes up that blue tube onto that blue pad and circulates the cold water to help with inflammation. We see these a lot with post-op knees. If you're a hip patient, you're more likely to come up with one of these bags. They'll put it on the surgical side right next to the incision to help with pain and inflammation. These are something we can constantly refill. If you need a new bag, we can get you a new bag. If you need more bags, we can get more bags, but these are commonly available. These are compression devices. We call them scuds. We put them around your bottom of your legs, and they push air through and kind of inflate and deflate. What happens is they work out the calf muscles to move blood. It kind of simulates the same muscle movements that you would get when you're walking. But since you're not walking around as much, it's good to have these. They help to prevent blood clots while you're here in the hospital. Unfortunately, big surgical procedures like hips and knees can cause rare but serious complications, one of which is a blood clot, also known as a DVT. We try to prevent these in as many ways as we can, and the number one way that we know to prevent them is by early mobilization. So that's why we're encouraging you to get up with your meals as soon as you feel able to. We want you walking around. We want you working with therapy. That movement helps prevent the blood from clotting. Your surgeon might also order things like aspirins or anticoagulants, and then the scuds that we saw in the previous slide are also all ways that we can help prevent these blood clots from happening. Some of our knees will be given a wedge cushion to kind of help elevate the leg and keep the knee at full extension, so as flat and straight as we can make it. This is helpful in healing because when the muscles are healing, we want them to be as long as possible. If your knee is bent, they're shorter, so when you start rehabbing, it's a little bit more painful and more difficult with mobility. Those knees that don't get a wedge, we can use a towel or a blanket to put under the heel. Again, I know it's going to feel more comfortable to go under that operative knee, but we want to keep your leg flat to help those muscles heal the way that we want them to. Nurses on the orthopedic floor work 12-hour shifts, so we'll have bedside shift report twice a day, once at 7 a.m. and once at 7 p.m. And this usually lasts for a half hour. Both nurses will come into your room. They'll discuss why you're here, how your day's been going, if anything notable had happened during that shift, and you're welcome to contribute things at this time as well. It's meant to be a conversation, so we get a well-rounded picture of you as a patient and what your needs are. So throughout the day, we'll have you get up to your chair for meals. PT and OT will come and see you, so you'll be moving around a lot. If you need to go up to the bathroom, you'll call us, we'll help you. It's a normal day, it's just with a lot of assistance. We'll also have your medications available for you. A lot of times pharmacy will standardize them, so they may be at different times than you're used to taking them at home. This may be intentional or unintentional. Either way, let your nurse know if there's any discrepancies, and we'll see if we can change those around for you or help make it more like your home regimen. Again, we want to be getting you up as much as possible, so expect to be ambulating in the hallways with nursing staff, physical therapy, occupational therapy, as well as walking to the bathroom and sitting up in a chair for your meals or at different points throughout the day. Mobility is the biggest thing, and we want to make sure that we get you up and moving to get you healthy and ready to go home. If you have stairs to get into your home or stairs within your home, physical therapy might have you practice and demonstrate what you can do on this set of stairs that we have in the hospital. We just want to make sure that your transition to home is safe and that you're able to get around as you need to. Surgical dressings are going to vary by surgeon to surgeon and from procedure, whether it's a knee or a hip. So this is just a couple of examples of some of the dressings that you would see. They usually include instructions in your discharge paperwork about how to care for that dressing, when you can remove it, and what to look for. This is an example of a knee the first day after surgery. Sorry if you're a little bit squeamish, but we kind of wanted you to have an idea of what the incisions will look like if you take your dressing off. So these little white strips you see going up and down the dressing are called steri strips, and they kind of help keep the incision in place and then help with healing. You might notice some bruising around the sites, which you can kind of see on this picture here, and that's totally normal. This is what we expect it to look like. The hospital provides a service where your discharge medications can be delivered to you at your bedside before you discharge. If you're something you're interested in, please let your nurse know. This service is available Monday through Friday during normal business hours of our outpatient pharmacy. Ultimately, we don't want to keep you in the hospital. We want to get you home so you can heal. So we try to provide you with the tools and education needed to get you home and to get you home safely. Now that you made it through this whole surgical process, we help you get ready to go home. So we have a group of discharge planners that go around and assess your home situation, answer any questions that you might have about discharge, and provide equipment like walkers or things that you might need in that respect. Nursing will discuss and give you your written discharge instructions. This includes surgical incision care. If you're going home with one of those on-cue balls that we talked about, we'd go over that information with you and address any questions that you might have about any of those things, when to call a doctor, and in some cases we'll provide you with dressing supplies and other things that you need to go home. Again, complications are uncommon, but we want you to be aware of what could possibly happen in case the worst does happen. So if you are experiencing any signs of possible infection, these are fevers, chills, increased drainage from your incision, please call your doctor's office and make an appointment with them to be seen. If you're experiencing signs of a blood clot, which would include calf pain or swelling on one side, please immediately report those as well to your doctor or go to the emergency room. And if you're experiencing shortness of breath, chest pain, or localized chest pain with coughing, this could be indicative that the clot has dislodged and moved to your lungs. Please seek medical attention immediately. Go to your ER, get that taken care of. We just want you to be safe. That's why we talk about these uncommon complications. We hope that none of them happen, but in case they do, now you know what to do. Final steps in the discharge process is getting you out of the hospital and back into your home. So if you have a private vehicle that's coming to pick you up, we recommend using a car over larger vehicles like trucks or SUVs. It's hard to kind of hoist yourself into these taller vehicles after surgery. Cars are lower to the ground and easier to get into. We would like your care partner to be here for the final instructions if they are able. Having 2 sets of ears listen to instructions are often better than one. We also send a written copy with you for reference, but that way if they have any questions that you had not thought of, we could address those as well. Your discharge time is most likely going to be in the afternoon after physical therapy and occupational therapy. If you need to leave by a certain time, if you live far away, it's getting darker in the winter time, for example, please let us know and we can try to work that out with the physician and therapy to get you out sooner. And even though you are going to be discharged, remember to call and don't fall. I know it's hard to ask for help for things, especially where you're at home where you feel comfortable and you're feeling better, so you're out of the hospital. But if you need any assistance at home, please ask a family member to help you. During the in-person class, we would normally leave this time for questions, but since this is all recorded, we recommend contacting your physician or Samaritan Physical Rehab Department with any questions that you may have. They should be able to answer anything that you might have questions about in relation to this presentation or any of the other presentations. We thank you again for choosing Good Samaritan Regional Medical Center, and we hope that your stay with us is a pleasant experience. We look forward to seeing you here. Thank you.